So here's the way it works with asymmetry. Almost everyone has an existing asymmetry similar to yours.
Okay.
Not everyone realizes it. You realize it because you're mindful and
Mm-hmm.
because you're experimenting with posturing your jaws in different ways to try to treat yourself, basically. The way it works with MSE and asymmetry is it's a crapshoot. Sometimes the MSE expands the side that needs the extra expansion and it fixes the asymmetry. Sometimes it does the opposite. Sometimes it expands the side that's already bigger and makes it and exacerbates the asymmetry.
Mm-hmm.
I went to a Juan Moon talk one time where he said it's like I forget the numbers he used, but he said it was 60-40. It's going to help the asymmetry rather than make it worse. For all intents and purposes, I would say it's 50-50. It could get worse, it could get better. The key to dealing with asymmetry is not to avoid the treatment entirely. The benefits are too good.
Yes.
Okay? The key is managing the asymmetry. And so the way to do that is basically to work with a doctor who has a plan for dealing with that, who is aware that this happens and who is skilled enough to fix it when it does happen. And the fix is almost always dental, which means that it's not, you can't really control the bone level asymmetry. There's just, the appliance doesn't have that much control.
Mm-hmm.
It's a very brute appliance. It's going to do what it does to the bone, and there's very little controlling that. Asymmetry is dealt with at the dental level.
Okay.
Unless Dr. Casey Lee's EASE procedure claims to essentially wipe out the asymmetry problem. And maybe that's true and maybe that doesn't. But generally, asymmetry doesn't seem to be as much of a concern with the EASE, although this guy who's been documenting his EASE procedure on
Yeah, I
YouTube
saw that. Mm-hmm.
is developing an asymmetry. So, but the thing about EASE is that it's such an efficient expander of the nasal airway because of basically the way that the surgical cuts are done intranasally
Yeah.
using the endoscope. EASE stands for endoscope assisted
Mm-hmm.
surgical expansion or whatever it is. Basically, the cuts are done from the top down rather than from the bottom up. And so what that does is it frees the posterior, which means the back of the nose,
Yeah.
whereas the MSE, this is a lot of people have been asking about EASE anyway, so it's a good opportunity to
Yeah.
talk about it.
Mm-hmm.
So this is the posterior, the back.
Yeah.
This is the anterior or the front. And Dr. Lee talks all about how his appliance is, I'm trying to get the autofocus to work with me here. He talks all about how his appliance, unlike the MSE, is really great at getting a perfectly uniform expansion between the posterior and the anterior.
Mm-hmm.
And when you have the posterior getting expanded skeletally, you basically get a lot more nasal expansion for less diastema.
Yeah.
So, in other words, the ratio of nasal volume increase to actual appliance turning, which could be represented by the size of the diastema, it's a very good ratio. In other words, the EASE is very efficient.
Mm-hmm.
You don't have to turn it as much as you have to turn the MSE in order to get the same nasal benefit.
So is that efficiency because of the cuts or because of the device that it uses? So with
Both.
MSC, they say it's like 50% dental and 50% skeletal or something, right?
I
Um,
don't agree with that.
okay.
It just doesn't seem right to me. I mean, you have plenty of people expanding with the MSE or with Dr. Yusefian's main, and they're not seeing dramatic, tipping of their upper teeth. Like, in many cases, the MSE is cut off from the teeth. They cut the arms off as soon as the split occurs, in which case,
Okay.
It's not even physically possible that the expansion is
Yeah.
dental at that point. So I don't buy that. But continue.
So I guess based on that, then the difference in the diastema probably just because it's not a parallel split as the eases, right?
More or
Yeah.
less, yeah.
Yeah. Okay.
Now, I would say this is in general, but I would say that there are plenty of MSE cases that achieve the efficiency and the quality of split that the ease achieves. But I think you can generally say that MSE splitting is much more of a shit show,
Mm. Okay.
especially because you have a lot of doctors not even doing surgical assists and stuff. They just throw in the appliance, and then the appliance,
Mm.
and I've always said this, it's more of an axe than it is a chainsaw. So, like, have you ever split wood? Probably not.
Yeah.
You're a
I
pianist. You have soft hands. You need to protect your hands.
I've split wood like for fun, I guess, in camps and so yeah.
For sure, for
Firewood.
sure. So, like, you know that you can have a log, right? And it's a perfectly circular cylinder,
Hmm.
right? And you could put a wedge in it, and then you could split it. But then sometimes one side is like fucking 30%, and then 70% goes to the other side, right?
Yeah.
It kind of depends on the grain and a million other factors. MSE is like that.
Hmm.
So you just never know what you're going to get in terms of the split.
Yeah.
The ease now, the fact that they're doing the piezoelectric bone cutting now to assist the MSE, this is really jacking up rates of success. Like Dr. Ilya Lipkin is doing this, Dr. Ting is doing this, other doctors are using the piezoelectric bone saw, which is an ultrasonic tool that it basically generates a tremendous amount of heat, and they put it up into the roof of your mouth and it splits the maxilla right there on the spot.
Mm.
This is the most cutting edge, no pun intended, surgical assist that they're doing with the MSE.
Okay.
And this is helping MSE probably become more like ease in its success of splitting. But ultimately, when Dr. Casey Lee essentially shits on the MSE, I think he's more referring to just how it ends up in general, where you have many cases of asymmetric poor splits or no splits.